share our thoughts with you. I believe that based on our active participation in this particular program, all the people, all the members who are here in the offline as well as online, they will be having some, at least some sort of knowledge sharing, which will help them in giving in this particular domain further studies or further initiative if they want to continue with that. So as you have seen this particular thing which we are talking about, this is the AI-driven medical imaging for early breast cancer detection. We will talk about some specific case study, and that will help you to understand. Just to understand the basic fundamental concept of this medical imaging and what is the impact of utilization of AI in this particular thing. I have mentioned about the specific case study for breast cancer detection. The background of which actually I can just refer some of the information which our Honorable Vice Chancellor has made in the beginning of today's discussion, today's meeting. Basically, that PET-CT thing he was referring to that, and he has emphasized the requirement for the analysis for breast cancer thing, cancer in general, and which we can talk about something in specific in case of breast cancer. Why I am going into that particular domain, that also I will let you know. Before that, I just try to mention that this is basically a situation where the combinational solution with the artificial intelligence and the advanced image processing thing, that will provide you some sort of early detection at the time basis of treatment. That is what is the target. Means in case of there are a lot of solutions already we have in the market for breast cancer detection. Standard practices are available for mammography as well as ultrasonography, and obviously the finding the biopsy thing, that is the ultimate solution. But then that becomes a typical problem of at different stages of cancer detection. So we will just mention about it, how the approach what we are going to propose is going to help you to improve the situation so that you can detect it at the early stage. Now, what is the need of it? First of all, that is what is most important. What we have to understand, why we will talk about breast cancer. Because this is currently the most common form of cancer among Indian women, both in terms of incidence as well as mortality, with proportional prevalence in younger age groups being higher than the global average. Unfortunately, that is the current situation in India. And particularly the way we are, the area where we are actually working is in the area of northeastern part of our country, and in there, these kind of situations are rapidly growing. So we have to consider those things. In fact, Government of India, Ministry of Electronics and IT, they have emphasized us to work on this particular area because of that reason. And there are two aspects has come up. One is breast cancer, another is oral cancer. So we have initially started, we have done this work and we have finished that work, we have got the product of it, and that product is already implemented and deployed in one of the two institutes. One is in the Kachai Cancer Hospital and the other one we have gone also for some sort of experimentation there. Probably in the future we will get to work there also, that is in Bihorua Cancer Hospital as well. We have done some initial study there also. But then the next part of it is the oral cancer. That part also we have started working on it. Today's focus will be there on the breast cancer thing. So one important crux of the point what I have mentioned over here is the cancer, which increases the probability of survival of the cancer. That is what is the bottom line. Now to have some sort of this activities, what we are talking about in terms of technological advancement and the utility of the presentation of the thing to the common people so that they get the output in time, and that can be helpful. Obviously, it is not an individual solution. It has to be deputed in hospitals only, and in the hospital management system, it has to be integrated with that. That is what is the target. So you can see that the key components are here are the image acquisition, pre-processing, and then automated detection and classification, risk stratification, workflow integration, explainability, and the trust. These are the main issues what need to understand, address it as per the requirement. In the first part, if you see, there are different modalities what we have mentioned over here. One is mammography, which is very common, people know about it, but that is very painful process. And that is, people, a lot of people, young women, they don't prefer that kind of testing, and the anti-analysis is bound to do that. So if if somebody is bound with that, is at the advanced stage, unfortunately. So we need to do some sort of exercise which can be done at the early stage. We'll go to that more. The other one is the ultrasound and MRI, and the final one what I will be emphasizing is the infrared imaging. Why we will talk about it, I will go into the details of that particular thing. This AI enhances the resolution. Why you are talking about the support of AI for this kind of solution? Advanced image processing is the main crux of the problem, supported by some sort of issues where the AI can help. That can reduce the noise, it enhance the resolution. So that resolution part is essentially the camera. The infrared point what we will talk about it is the infrared camera. Whenever we are going to utilize it, there the resolution of the camera is a very crucial problem, because based on that resolution, the cost of the camera goes high. So if you go to the high resolution range, but there if you can have some sort of solutions provided through some AI supported algorithm which can improve the existing whatever currently at the mid level or the lower level of resolution, it can be enhanced. This image enhancement, there the AI can help you. So that part we can also highlight. The other part is the reducing the noise and obviously the standardization of the input. Yes, that is one important problem, because in different stages, different types of data formats are there. So as per the standard requirement, if you want to go worldwide standard, then we have to see that some sort of solution which can, if the variational inputs are there, then AI can take care of that issue and give it a smooth input to the final data collection process. And the analysis part is something anyway there. Obviously, you can see that AI has got good inputs that can be helpful. Automated detection on the classification part, which obviously will identify the particular lesions, masses, and the micro classifications. That those things we have to take care of it. And the classification of that particular lesions will be definitely benign versus your malignant issues. So those things will come as the image picture. When it will outperform, it will help the radiologist basically to actually give the proper outcome. Risk the stratification is basically handling the personalized risk prediction based on the imaging feature and the patient data. There we need to take care of the patient. This all sorts of data from the patient whenever we are going to collect the data. In the beginning itself, integration with the genomics, family history, and the clinical record. So these all one need to take care of. Then comes your workflow, procedure. There are certain tools which can use like say PACS, this picture archiving in the communication system. You can have the RIS type, that is the radiology information system, which can help the radiologist to assist and improve the performance. Reducing the interpretation time, that is obviously important, because see that as the earliest process, if you can interpret and give some proper certification by the doctor, then obviously it will help the person to go under the proper medication. So these false positives and false negatives, those things we will see that I will show you how the performances are coming up. And there are situations, in sometimes we have found that even if their situations are not really falling to this category, the cancer is not there actually, but there are certain false diagnostic outcome. There, the problem of biopsies and all that, they people come up. But as you know, biopsy is an invasive process. So definitely if we can just avoid that. So unnecessary biopsies can be avoided. So that can be one issue particularly in this kind of domain. So obviously this is how we have to talk about it. Now why we are talking about what are the benefits? Early detection of the breast cancer at the treatable stage, that is what is the first target. Then reducing the workload for radiologists to improve decision support, because day by day the cases are coming up like anything, and the number of radiologists are optimum in figure till now. So manual interventions, if we can avoid to the extent possible, then obviously it is an improvement in the situation. Standardization across the institutions and the radiologists which I mentioned earlier, improved outcome via timely and accurate diagnosis. Accuracy is definitely one important issue. I will show the outcome of our system. Bias, there would be definitely some challenges as to resolve those issues what we are talking about, which we think that it will help the system in practicality. But the challenges would be like something like the bias in the training data. Like we have to have different group of segregation of the data at different levels, like based on the age, ethnicity, breast density. These are certain important factors which we need to take care while we collect the data. And we have to segregate it. Based on that segregation, further analysis can be done and some conclusive statement can become out. Regulatory and ethical concerns is definitely very important. Each and every this kind of situation, if everybody who are working in the medical domain, that you all know that we require to get the clearance from the ethical committee of any of the hospitals or wherever you are going to do this kind of data collection. Data privacy and interoperability, that is most important these days. As you know, we have discussed sometime earlier also that cyber security issues are coming up, and it is creating lots of problems throughout the country as well as across the globe. And even if you have got certain personalized data uploaded in the particular domain, maybe through some Google Drive and all that, then there will be some issues. So we have to create certain protection for uploading those kinds of data. It should be somehow unnamed or at least specific to certain areas of the particular focus, so that it cannot be personalized. So those protection is very crucial. Need for robust clinical validation. Yes, clinical validation, I will make some detailed information about that. Whatever data we are collecting and through some technological outcome, through the product what we are going to discuss, that needs to be validated by the experts. Experts means the oncologists, and that is very crucial. And those things has to be done from the beginning of the data collection itself. Now we are talking about the particular area where today I will be focusing on the case study will be focused on that area in the thermal imaging. So all the other modalities I have mentioned about, some comparative statement I will also give right now so that people can understand why we are talking about thermal imaging. It is a technique that uses infrared radiation to create the images of heat differences, essentially a heat map of a particular area. That's what we have to take care of. It converts the invisible infrared energy into the visible light, allowing us to see the heat variations which we cannot normally detect with our eyes. That's what is the area where the thermal imaging are coming into picture. So the processes would be starting from the infrared radiation, understanding of that part, what the heat map we have talked about, that is the object with the absolute zero aim in the infrared radiation. First and foremost thing, what we want us to understand that infrared imaging for even in the health domain there are a lot of applications. I will be talking about the breast cancer detection part that we have worked on and we have developed the product. That's why I mentioned it about it. But other than that, there are many other cases that we have also worked for, the diabetes detection using this infrared imaging. So those things, wherever you go for this kind of utilization of the infrared imaging, one basic understanding what to clearly keep it in mind that infrared imaging is not harmful. The meaning by that, it is not X-ray. It's not something which is coming onto your body. Rather, it is reverse. Means whatever emissions are coming out of the human body, that is being captured by the camera, infrared camera. So it is not at all harmful. That's the first and foremost thing one has to understand. detection. Thermal cameras have infrared detector that capture this particular radiation. So this radiation what I am talking about, each and every time everybody is having some radiations coming out of the human body. That where you are going to capture at what level and to what extent you want to analyze it, those things depends on your capturing device. So in that capturing device, essentially the detection part for thermal camera, that is a crucial part. Conversion, the infrared energy is converted into visual image where the different temperatures are represented by different color or shades. Those colors can be pseudo colors just for making some standardization. One can understand that if the temperature zone is very high, then it would be reddish, you can keep. If it is somewhat in between, then you can keep it in yellow, or it can be not to the lower level. If it is very cool, then you can keep it as a blue. So these are the certain standard shades, color shades one can utilize. So then what I have just to mention about is the interpretation of that particular part. How we can do that? By analyzing the image, we can identify areas with higher or the lower temperatures which can indicate a variety of issues such as leaking of information, overheating types or any other anomalies, whatever you are finding it out. Those things can be handled utilization through the advanced technologies where AI can play some crucial role. Yes, this is what actually I was just trying to tell you. This diagram will make you understand that why we are talking about infrared imaging. What is the need? Infrared imaging, you see the levels. First of all, one important issue for the early detection case. At what stage infrared image based solution can provide you the information? See that this diagram is making you understand. First of all, active cancer cell can double in number in every 90 days. This is a standard information, one can keep it in mind, right? Then, for the first time, if you say 90 days the 2 cells, 1 year 16 cells, 2 year 256 cells. So at the stage of 2 years of this particular issue, infrared images thermogram can be seen at that stage itself. You can understand that. We are going down. 3 years 4896 cells. 4 years, 65,536 cells. 5 years, 1,48,000. And then see that still it is undetectable with the mammogram, even at the stage of 5 years. And if you go beyond, it is coming at the level of 7 years, you can get detectable with the mammogram where you see how many number of cells are coming out. And beyond that, it can go 8 years and onward. You can have other mechanisms can be detected in that. See that what we have just tried to give the impact on it is the infrared imaging system can detect the thing at the earlier stage, that is at the level of 2 years even. So that is one big advantage of utilization of this kind of technique, and that is why we have gone for this particular solution. There are two things already I have mentioned that mammography is highly painful. Yes, everybody knows that. USG and MRI, very costly solution and also cannot give it at that particular level. And biopsy is definitely the gold standard, but that is the final stage. Once it is detected and it is being confirmed that person is having this particular problem, then biopsy gives you the final gold standard outcome. So that is an invasive process. That is at the last stage you can do that. So this is what, as I have briefly mentioned, the global health concern here, breast cancer detection is one of the issue. Thermal imaging study is required for the detection of this process. We have talked about the integration approach where the data, image and the learning is the outcome of that. That will be the actual requirement. For our case, this specific thing which I would like to mention is the rotational thermographic imaging for breast cancer screening. I will show just a video, a small video is there also, that will make you understand how it works. Dynamic temperature control, these two factors, how we are handling it, that I will mention about. Color-based infrared image processing in detection process, that is also very crucial, how that can be done. And obviously as part of the AI, these machine learning models usually help to achieve the higher accuracy level. And promising tool for the breast cancer screening is the outcome. Benefits, the cost-wise you see, normally the screening of breast cancer is done using mammography, USG, MRI which is costly, and with the respect to infrared-based imaging screening technique for individual patient. Application domain benefit, if you say, the mass scale screening with the non-invasive, no touch, no pain. These three are very crucial information one can keep it in mind. No touch, it's non-invasive one. No touch, no pain. These two are very crucial. And this can be effective for all age groups. Like mammography is not applicable for all age groups, but this one is applicable for all age groups. Target beneficiary, hospital, common mass, breast tumor patients at early stage including younger age, breast cancer operating patients for post-operative monitoring as well. Both the things are important. Now, impacts, if you see, there are certain things which normally we talk about, the functional versus structural imaging. There, the IR imaging captures a thermal pattern. So, while you do this kind of thing, which is a surface temperature, that's one important point. The infrared image means the data whenever we are collecting, it is the surface temperature of the human body up to a certain level of thickness, up to that level only. But then, variations due to the increased blood flow and the metabolic activity which can signal the tumor growth. Even at different stages, our system has got that facility to detect at different stage levels of the outcome. Means whether it is growing or not, whether after the treatment, at certain level of treatment, whether it has improved or not. Those studies also can be done using this particular technique. And then benefits of this IR in AI detection system is something like this. You see that the non-ionizing and contactless thing, that is part. Early physiological changes where the thermal anomaly often precede the anatomical changes detectable by mammography. Augmented data for the AI, that's what is required because the number of data, that's very important. I will mention over here that collecting this kind of data is not that easy. So, particularly in the medical domain, you will not get thousands and lakhs of data. It's not that simple. As you can understand, people are not very much, normally they are reluctant to provide this kind of experimental setups and all. So, it is very important that we need to go for augmentation. Data augmentation is also a part of the system which will help you to improve the overall system where the artificial intelligence is helping you, the procedural method. Role of AI, as we are talking about, is the pattern recognition, which AI can analyze the starting temperature asymmetry and the vascular pattern invisible to the naked eye. Noise reduction I have mentioned, and obviously the risk stratification is the another part. Certain limitations are the challenges like lower resolution compared to MRI or ultrasound. IR offers less detailed anatomical information too. So we need to have this kind of high resolution solution using AI sensitivity and environment, where the results can be affected by the room temperature, patient activity or clothing. So in that case, basically the requirement is that whenever we collect the data, the patient, whenever the patient is coming, we need to acclimatize the temperature. So for at least for that 10 minutes are required. People have to sit for a particular in a particular zone, and after that the data has to be collected. The technique how we are collecting the information in case of a breast cancer affected person, I will show you through the diagram as well. You can understand that part. Lack of standardization also one important issue is that it is not universally accepted protocols yet because this is under experimental stage. So things are happening, it is improving, but still now people are not giving any international standard for this particular solution. Emerging trend, multimodal fusion of AI models which are gaining attraction, combining thermography, ultrasound and mammography to leverage the states of each modality. These three you can combine. Along with that, this IR imaging. So there are certain stages. We have collected all the data. For a particular patient, we have collected the infrared imaging data, then the mammography data, as well as the ultrasonography. All these we have collected, compared and validated finally by the expert doctors. Studies from India and Brazil, where essentially parts of Africa, they show promising results in low resource settings where the access to high-end imaging is limited. Infrared imaging based solution is now we have developed a low-cost solution. I will explain some part of that part as well. So technical aspects as we have talked about, certain data processing techniques are there, some AI model architecture, standard CNNs and all that, and you can have some multimodal models which I have also mentioned. These are certain things which you need to understand. Feature extraction, the kind of features what we are talking about, the shape features essentially, texture and the shape descriptors. These are certain aspects what we can do it, and obviously for machine learning classifiers you can do it. We have done that SBM as well as some other FCM technologies and all that. I will explain that part. There are certain sample workflow where you can utilize the particular part of the thing which we have talked about in terms of the challenges. So that also can be talked about. There's a data sets, if you think of it, they are digital thermal phantom imaging, that is DTPI, which contains the level IR based images, some available data sets they are talking about, some references. But ultimately you have to take care of your own real time data. That's what is most important. Performance metrics, accuracy, sensitivity and specificity, and AUC and ROC, that the region of interest and region of contour, those things are required. One has to see that which one is falling under the particular category. Now I am coming to the focusing to the particular case which I have mentioned in the beginning about the IR based breast cancer detection case study. Let's go into the specific solution. Initially, I have tried to cover the overall idea of kind of imaging, the medical imaging solutions in different forms, and there obviously apart from the infrared imaging, the mammography, ultrasonography, and MRI, all these things I have mentioned about it. Now I have just emphasized on the infrared imaging. Why we have gone for it? I have mentioned about that background also. Now we will see that the steps and forward how we have developed the system. The maximum usability and the comfort. Yes, that's one important aspect. I'll show you how the diagrammatically how the data is being collected. So you require kind of people who will handle this particular solution. That we have utilized something like that. Even the technicians, the nurses, the doctors, and the analysts, they can have their different levels of involvement. So technicians can help you to just to set the overall setup. Once it is done, then no technicians are required. Only the nurses they can do it because this is specific to the human, this is the women people. So we need to put the nurses over there. That's all.